Okay, Jaya, thanks for coming today. Perhaps you'd like to tell us just a little bit about yourself and then what you would like to share with the IMTs here today.
Thank you, Christina. So my name is Jaya. I'm one of the IMTs currently working in the Midlands, and I really wanted to share personal experience with everyone. It's quite, with working with interpreters, I feel there's a lot to learn from this, and hopefully moving forward we can all try and change our practice. So last year one of my family members, he was diagnosed with a terminal disease. From kind of diagnosis to when he died, it was very quick, and it was quite a shock to all of the family, really. So he was someone who was fit and healthy, had a regular job, so it did come as a big shock. Unfortunately, he didn't speak much English, which meant that a lot of the time family was needed to have be able to translate for him. This was difficult in hospital because obviously there was restricted visiting times. However, it meant that sometimes him having a conversation with the doctors was delayed because we needed to wait for a family member to have that conversation. Unfortunately, there were independent interpreters used, but it was quite rare. They used them to discuss the diagnosis. However, kind of after that, subsequent reviews, mainly family members were used. This was quite hard on the family, and they found these conversations to be quite traumatic. And obviously they wanted to do the best they could for the family member, but also taking on that emotional burden. There was an allied health professional working on the ward. However, they felt that actually it was quite difficult for them to have the conversations. So unfortunately, that professional wasn't used. And unfortunately, during the time on the ward, no telephone interpreters were used. I think unfortunately things such as advanced care planning and things such as talking about wills and moving forward, future planning, did not happen. I think mainly because of the language barrier. This led to, unfortunately, my family member dying without a will, and led to other consequences. So I think if an independent interpreter had been used earlier and probably more frequently, I believe that things may have been different for the family, but also for the patient. But I think really it's something that it is an important discussion that we should really start talking about. So that was what I really wanted to reflect on today, Christina.
Thanks, Jaya. That's very kind of you and generous of you to share that today. Can you just reflect a little bit more on the impact on the family members of being asked to be interpreters, do you think?
Yeah, so I think that they wanted to do the best that they could for the family member, but sometimes symptoms such as pain or agitation, I think for anyone that's quite difficult to explain to a health professional, and if that's someone that's close to you, that's probably even worse. And I think it's probably unfair really for us to try and rely on family members, because I think the family member should, personally I believe that family members should be the family member and be the support network, the emotional support network for the patient, rather than also a translator.
And the health professional that you said was on the ward who did share the same language, are there any further reflections on members of staff being interpreters or being asked to be interpreters?
Yeah, so I think obviously if it's a doctor or a nurse who's used to having conversations and potentially is trained in having quite sensitive conversations, then I think potentially asking those staff members probably would be okay. I think someone who it's not in their job description, it's not what they usually do within their role, I think that can be quite a tricky ask, and it may be quite unfair on them. Sometimes they may think actually they're not the right person, but sometimes it's because they're the only one that can speak the language, it's difficult for them to vocalise. So I think sometimes it can be a little bit unfair relying on one person.
Okay, thank you. And so how would you want to put over the take-home messages for anyone that's learning from this video, Jaya?
So I really think the take-home messages would be, number one, try and get an independent interpreter as early as possible. If that's face-to-face or if for whatever reason that's not possible, telephone is also a good way to start conversations, especially with the technology we have now. I think that's something that I'd definitely say for us to use. I think another take-home message would be try not to use family members as kind of the fallback option, because it can be quite traumatic, and sometimes family members don't want to say no because they know they're the only ones that can have the conversation, but kind of thinking, let's try and see what skills and what tools we have in hospital before kind of reaching out to the family.
Okay, thank you so much.
Thank you.